Recording in progress.
Welcome everybody to the April 17th, 2023 Health and Human Services Committee meeting. I think we're going to have a short meeting today. We already had a short agenda, and the one presentation we had to cancel. So I'm sorry about that. But that's what we got. So are there any other changes to the agenda that anyone knows about? Okay. There's no public comment, I assume. Thank you. I do not have a chair's report. So, like I said, I already said we're skipping number 5. So we're on to the county administrator's report. Bridget?
Good afternoon, thank you. Just one brief update. The position of Homeless Services Coordinator, which will be positioned in county administration, has been offered to and accepted by Tammy Baker, and she will begin in that position May 15th. And that is all I have.
Excellent, thank you. Questions or comments for Bridget? Okay.
I'm familiar with who she is. I think we're probably lucky to have her. So.
Okay, then next up is Office for the Aging. We have one resolution. Lisa, hello. Lisa Monroe, are you here yet?
Lisa may be having some difficulty with her microphone.
Okay, no problem. Lisa, we will come back to you. So that actually means we're going right to departmental updates. Kate, since you spoke up, that means you volunteered. Do you have anything for us?
It is good afternoon. We're just busy over here. We hired our project assistant, as I mentioned, last HHS meeting. She has started and working. We will be having our meeting with 211 next week to sort of set our format. So we're excited and that's getting underway. And then one thing I did want to bring to everyone's attention, we all know that mental health crisis that our youth are facing right now it's pretty substantial, and it's been happening over a long period of time. There's a documentary that has been making its way around different film festivals in the country called Anxious Nation. Again, that's Anxious Nation. It's going to be streaming, I believe, on May 3rd. You can look it up and check out the trailer. It is, I believe it's $7.99 for parent or for youth, and then adults, I think it's like $12.99. You could purchase tickets to watch it on that evening. But we do have a meeting later this week with the producers of this film, and I am hoping that we'll be able to bring it for a local screening and then do a Q&A session afterwards to help address that. So I just wanted to let you all know that that was in the works. And if for some reason we can't bring it, I would still really recommend that you at least check out the trailer. It looks like it's done really well.
Excellent, thank you, Kate. Are there any questions or comments for Kate? Okay, thank you. How about J.R. Claiborne, Veterans Services? Hello there.
There, it works when you hit the mute button, right?
It works.
Good afternoon, everybody. Not much to report today, except just to share that, the American Legion has an annual, the American Legion and their auxiliary have an annual program each year called Boy State and Girl State. The Boy State is sponsored by the American Legion, Girl State sponsored by their auxiliary. And this year Tompkins County will be represented, I believe for the first time in a decade. We'll have representatives at each one. That's going to happen this summer in July. And Boy State and Girl State is basically, it's a week of immersive civics training where the citizens, as they're called, are basically immersed in running government for a week. So from I believe from just their town all the way up to a governor position, and they run a fictitious state for the course of the week. So they learn a lot about just the legislative process, about civics, civics and things along that line. So I was happy to report, though, that we will have Tompkins County will be represented. For Girl State, we have an Ithaca representative, and for Boy State, we'll have a student from Lansing. And to be selected, you have to be in the top third of your class and a junior. So that's pretty neat. And then the other thing is just to share that Reverend Clark and I, and he'll speak for himself, I'm sure, but I'm including him. We both attended last week a meeting for a new commission that Senator Leah Webb has formed. It's called a Civil and Human Rights Issues Committee. It's our first meeting, so basically they're trying to talk to people across her district, which is Cortland's, Tompkins, and parts of Broome, and about different issues that are on the ground related to human and civil rights. So that's all for me.
Thank you, JR. Any questions or comments for JR? Okay, well, you passed the baton to Ken, so Ken Clark, Office of Human Rights.
Good afternoon, everyone.
Good afternoon.
I have several things to report. I'll start off with where JR left off, that this Civil and Human Rights Council will be meeting on a regular basis with Senator Webb as we begin to explore how to address these issues as they are at work and need to be addressed and highlighted in the district that she serves. I wanted to report that OHR, along with the Prison Education Program, received a Cornell Just Futures Engagement Grant of $25,000. This will enable a collaboration between OHR, the Cornell Prison Education Program, in particular working with Richard Rivera, and Dr. Jen Micah, who teaches in Applied Economics and Management at Cornell, to address racism, dispossession, and migration in the United States. So we're forging a campus community collaboration to create programming and media for a broad spectrum of county residents on immigration practices, migration patterns, and the process of migration. And it will also explore how perspectives on migration have been racialized. That is, for example, these repeated negative racist descriptions of Central and South American immigrants attempting to cross the southern border of the United States. We will be working with a group of students in Dr. Micah's AEM course this coming fall to plan 3 events during 2023-24. And they will be using research that was done in fall 22 by a different group of students that Richard and I worked with last fall. A large part of the funding will be devoted to creating a 30-minute documentary highlighting these events to provide analysis of human rights violations faced by immigrants and clarify fact versus fiction related to the realities immigrants face and the realities of the immigration system. We have an upcoming program that I commend to your attention on this coming Thursday at 5:30. We will be hosting a program on human rights, climate change, and media coverage, which will feature investigative journalist Mark Hertzgaard, who is the co-founder of the organization Covering Climate Now. And this is co-sponsored with the Park Center for Independent Media at Ithaca College. That'll be taking place on Zoom at 5:30 p.m. on this coming Thursday. We are also preparing to post for the program and outreach assistant position in the office. And hopefully we'll be able to have someone in place for that office within the next several months or so. And just some brief snippets on some of the things that I've been involved with community-wide. I was asked to moderate a panel during the Finger Lakes Environmental Film Festival, or FLEF, on the recently released Dorothy Cotton documentary. As many of you know, Dorothy Cotton worked with Martin Luther King Jr. in the Southern Christian Leadership Conference during the 50s, or rather in the 60s, and lived here as a resident of this community for 36 years. There's been a really well-regarded, superb documentary done on her life called Move When the Spirit Says Move. And covers her life, and I moderated a panel discussion with the filmmakers who were behind the documentary, but also participated in a panel discussion in another program during FLEF, which was focused on the histories and legacies of African-American food culture, which was based on a display done in an exhibition done at the Cornell Botanical Gardens. And finally, I was a speaker at the conference that the Human Resources Office of the College of Arts and Sciences hosted at Cornell called Can You Hear My Voice? The Impact of Untapped Marginalized Groups in the Talent Management Space on April the 5th. It was really a well-regarded conference. Several folks from the county as well as the city and also campus were participating in this program. And I looked at how to, from a human rights perspective, how to attract, retain, and motivate highly skilled employees from marginalized communities. So that's my report.
Thank you. Lots going on for you and your office. Any questions or comments for Ken? All right. Well, thank you very much.
You're welcome.
Lisa Monroe, are you with us?
Can you hear me?
Yes, we can. Hello.
Okay, now I've got my audio working, but I don't think my video is going to work. So I'll just proceed anyways.
Please.
As long as you can hear me. The only thing I wanted to announce is our open house. We're going to be having our open house to celebrate Older Americans Month, Friday, May 12th from 1 to 4. Everyone's welcome. We'll also be recognizing and doing a small ceremony for our outstanding volunteers for the year. I also wanted to mention Food Net Meals on Wheels Mac and Cheese Bowl. It's their biggest fundraiser that they do. It is May 3rd, 4:30 to 7 p.m. at the Ithaca Farmers Market. There'll be lots of vendors there that help provide aging services to the community, as well as lots of entertainment, fun things to do, and mac and cheese, of course. So we'll have that, and I think that's all I have to share.
Thank you. Any questions or comments for Lisa? Okay, and then Lisa, you also have a resolution, budget adjustment, Tompkins County Office for the Aging American Rescue Plan Act, Ithaca Neighborhood Housing Services. Amanda moves. Travis seconds. Lisa, is there anything you want to say about this one?
Yeah, it pretty much says what it is. It's just supplementing $15,000 to INHS from our American Rescue Plan funding to help whittle down the wait list that we have for services in people's homes.
Thank you. Randy.
Yes, thanks, Lisa. How many people are on the wait list?
Well, we provided some funding to them probably a few months back. They've gotten it down a little bit, but at that point it was up to about 76 people, which is the highest that I've seen it in quite a while. It usually runs in the 30s or 40s. But they were able to hire some contractors to do the work because they were having workforce issues with their own folks. So they were able to hire some contractors, and this will just allow them to keep them on to have more workforce to be able to do the work. It was really getting backed up because of that more or less than anything.
Thank you.
Mm-hmm.
Any other discussion? Okay, let's have a vote then. All in favor? That is unanimous. Thank you, everybody.
Thank you.
Thank you, Lisa. Okay, we are back to departmental updates. Let's see, Kit Kephart, you are on. Department of Social Services.
Hi, everybody. How you doing?
Good, how are you?
Good. So let's see, updates for Department of Social Services. I think everybody knows that Saturday was the end of the contracted period of Code Blue sheltering. So Code Blue is the specific homelessness program that is in effect when the weather is 32 degrees or colder with wind chill. So that wrapped up on Saturday, and I was not able to actually get solid numbers right at the moment, but we're seeing around 125 people homeless right now. The majority of those are adults with about 15 children. And we as a department, and we in working with our partner St. John's, are working on a concerted effort towards permanent housing. So we're always working in that direction, but we have really put some extra resources towards that recently and trying to get people into permanent housing right now. Our HEAP program, the Home Energy Assistance Program, we got good news at the end of March that it was extended until April 28th. HEAP is always a program that gets extended either until that date or until the benefits run out. But currently we are still serving people with that. And HEAP has been a huge help to people because what we've seen over the last couple of years through the pandemic is that as costs have increased, people rely on that program a lot more these days to kind of offset increasing costs of all sorts of other services and goods. So we were really pleased that that got extended this year. We didn't expect that. And you know, just last in terms of our department, we continue to see increasing need around adult protective services, particularly I think as our population ages and more people need assistance with the representative payee program, we continue to see our numbers rise in terms of supporting people through that program. So we are busy and trying to keep things on track and get services out to people. So that's my report.
Thank you, Kit. Any questions or comments? Okay. Oh, we do have one. Randy.
Thanks, Kit. My aunt applied for HEAP and got it, and she uses fuel oil. It's been very expensive, so I know she appreciates it. She's in her mid-80s, so it's very helpful. She's on fixed income. I just want to say you're not alone as far as other Department of Social Services people being without staff. I see an ad here for Schuyler County in their, it's a penny saver type paper, and they're advertising for social welfare examiners, and they pay $21.61 an hour, just to put that in perspective for you. And I saw another ad in the same paper, and it's from the Food Bank of the Southern Tier, Schuyler County, and it's on SNAP, and they talk about how they will do the application process and do the qualification part of it to see if the application is going to do any good, but they don't do the work after that. They just help with the application. So I just wanted to share it with you.
Yes, thank you, Randy. And we do have our currently our social welfare examiner position posted, and so we are. I think that across the state, certainly from what I hear across the state, I think that everybody is struggling with staffing, and not just public entities, but we certainly see our private partners really struggling. So yeah, and I am hopeful that we're going to see some good people applying, and that we'll be able to fill some positions, which will help. So yes, thank you.
All right, thanks, Kit. All right, next up is Whole Health. Frank Krupa, hello.
Hi, good afternoon, everyone. Just one update. I think everyone's aware the state budget hasn't been passed yet, and so that means there's still opportunity. The legislature all passed the resolution regarding tobacco, banning flavored tobaccos and adding a $1 tax. That is still on the table and being discussed. So if you're so inclined, a call to Assemblywoman Kellis or Senator Lee would certainly be helpful. So there's still some work to be done to get that passed at the state level. But otherwise, Dan, I don't have any other updates. I'm happy to answer questions.
Thank you. Are any questions or comments for Frank? All right, thank you. Next up, Cindy Wilcox, Human Services Coalition.
Hi, good afternoon, everybody.
Good afternoon.
Hi. So a quick update for us. Our city-county review process is underway. So we will be bringing a little more detail around that process to this committee next month. I believe we're on the agenda for May. So we can help educate and inform the legislators around that process, but applications have gone out to organizations. And I think John may have reported last month when I was not at the March committee, but we did hire a new director of leadership development and consulting services. And she is, her name is Shasta Savage, and she is amazing. And she has a social work and trauma-informed care background. So we are anticipating, in support of all of the work of both the county folks and the not-for-profit sector, that will be providing quite a bit of trainings and professional development around kind of trauma-informed care, and really trying to beef up those resources, not just trauma-informed care for clients, but trauma-informed organizations, because we have to take care of our own folks as well. So we're excited to kind of bring some of those resources, more of those resources, to the community in support of all of the work that we're doing. So we actually have a workshop on April 27th specifically for creating trauma-informed organizations. So check it out on our website. And I'll talk a lot more next month, so I'll shut up now.
Any questions or comments for Cindy? All right, thank you, Cindy. Next up, I wanted to get a little update on the opioid task force. This is something that we, the legislature had formed, I think it was at the end of 2022. So just thought it'd be good to hear. And Travis, you were the chair of that committee, is that the task force, is that right?
Something like that, Dan.
Something like that?
Something like that. Randy or Zoe, if I missed something, please feel free to add. We've been meeting for several months, a few times a month. We heard from 4 different service providers in the community, emergency services, and we had a survey go out to kind of hear from the community, especially for those who have some lived experience, what they needed, what they felt was important. Currently, we're working on an RFP to kind of figure out what the application process will look like. And that's kind of where we are. We're hoping by tomorrow to have the RFP done and get it out so that by the end of May, we'll be able to go through applications and start getting some money out.
Thank you. Any questions or comments for Travis?
I'd just like to add that we're looking to fund organizations for 3 years, for a period of time, not just for one-time use. So we have a program to measure. So.
Can you remind us about how much money we're talking about?
It's close to 700,000.
And do I have this right, that it's 700,000 this year and then like half that much going forward, or do I
No,
it's every year?
It's that much this year. It's one time, and there may be other monies coming in, but right now this is the pot of money, and it's a one-time pot.
And the county also received $700,000 roughly, and Frank could speak to this, that is being done by the Community Health Board. I forgot, maybe Frank, you correct me on that one. And so there's communication between the 2 groups, so to make sure we're not overlapping things. But Frank could probably speak more clearly to that.
Sure, thanks, Randy. Yeah, it's the Community Services Board. So the local government unit, or the mental health component of our department, is responsible for a second pot of money. And so that's going through the Community Services Board review process now. And actually, some proposals have been sent to the state for an initial approval. And much of that is going to be focused around wraparound service for high-needs individuals that are ending up primarily at the ER or admitted to the hospital to try to prevent those unnecessarily hospitalizations. So it's really some high-intensity targeted care management that we're looking to wrap around folks. So hopefully we'll know more about that in the next month or so from the state on their approval.
Thank you. Where is that pot of money from?
Same place, it's settlement funds. So the settlement funds were broken up into kind of three main pools. The pool that went to the state, the pool that came to county legislators that the task force is working on, and then a pool that's coming through state agencies to the local government units for allocation.
Great. Roughly how big is our pool?
They're both about 700 to 800,000. So I think it's close to 1.3 million total between the two.
Great, significant amount of money. Any other questions about the opioid task force? Okay. So let's see. Cindy Wilcox mentioned that next month we've got a presentation here at this committee from the Human Services Coalition about the agency review process, which is, I don't know, it was about a dozen or 15 or so not-for-profit organizations in the county that receive county funding, and rather than we, the county legislature, vetting each one, we basically contract with the Human Services Coalition to take in their applications, review them, and make recommendations of how to spend that money. And it's a really kind of a big, important part of what we do, but since it happens outside the legislature, I thought it'd be worthwhile to, make sure that we understand more about how they handle that on their end. So that's next month, and then also next month, we're gonna hear a little about tobacco enforcement. We had that big debate at the legislature, was it last meeting, I think, about tobacco and tobacco sales and a little bit about tobacco enforcement. So we wanted to hear a little more from our health department, who does the actual tobacco enforcement in this county. Is there any other business before this committee today?
I had a constituent, Dan Winch, contact me and ask me about gambling funds, money we get from the casinos, whatnot, how much of that money is being used for helping people with gambling addiction. I didn't have an answer for him. I just wanted to share that. So
this might be a little too blunt, but I think the answer is zero.
Okay.
Yeah.
Well, I'll share that with him.
I think at this point, we still put into our general fund, and part of the reason for that, I hope I'm not getting in trouble with admin here, is because we don't know how much we're going to get every year. It's kind of a gamble, if you will. And this program has only been going on for like 4 years or something like that, and we have felt that there's not a long enough track record to actually count on how much money we're going to get in any given year. So that's part of the reason we haven't really fully formed it into a dedicated spending line. That's part of the reason. And then also there's this rumor, and I don't know much about it, I don't know if anyone does, that the state is going to take that money back. So we'll see if that happens.
The online gambling side of things has grown quite a bit for revenue for the state. I think I saw something like, I don't know, $150 million are getting for what do people do gamble online? I forget what's it called? I don't know. Sports gambling, I guess. I'm not sure that. Yeah, I don't do it, but so their revenues for the state have climbed a lot. So
I also read something recently, and I was shocking how big that number is. I think I remember hearing New York's the #1 state in the country, but even though we've only legalized it for like 2 years.
Big money, yeah. If that's good or not.
Oh, Kate.
Yeah, the gambling funds, I just wanted to remind you guys, last month I had said that because of the legalization of gambling that's happened online, $5 million of that has been earmarked to go to youth programming, and that is being funneled to the Office of Family and Children's Services, and they do a formula. Last year, we got about $10,000 that we were able to utilize through the partnership with CCE, and then this year we have gotten about $33,000, and we're going to be working again with CCE and then with the local YMCA to do some really cool programming. So there is some good coming out of those funds.
Well, yes, there is good because it's a lot of money. I'm just curious, Kate, is your programming gambling targeted or not really?
No, we don't. No, we don't tease them out of gambling.
I don't mean. I meant like anti.
Yeah, no, I was just teasing. It's movement based, so it's sports it's based on sports, but sports in a very loose term. So it's teaching kids life skills through, it can be dance, it can be improv, it can be a lot of different things. And so I think one of the things we did last year, what really cool at CC is we bought some cross-country skis, we bought some pickleball sets, we bought some geocaching equipment. And so then those sets went around to the different commissions of the different municipalities, and the kids were able to have experiences that they wouldn't have had otherwise. So it's been really cool, and we're really happy to be able to expand it. So, but I was just teasing. I know that we don't
I'm always up for teasing, I really am. Thank you. Randy, I was thinking a little more when this all first started, which maybe was more like 5 or 6 years ago, I'm not sure now, it's hard, it's a little vague, a little blurry. We did have a discussion that first year of like, is there a way that we can do some anti-gambling activities or education or whatever? And we really didn't come up with much. We weren't, this is how I recall it at least, we weren't able to really identify how big a problem it is in this county, and if so, how to identify it and where to target any efforts we might have to counter it. So it's probably worthwhile having that discussion again, but we didn't come up with much the first time through. Amanda.
First of all, I think you skipped several things, but
Oh, yeah.
but I had something I was going to say. You in a rush to get out of here?
I'm not.
I was just going to say that I'm the liaison to the Health Planning Council, and we had our last meeting at the Alcohol and Drug Council facility, the new facility, and then we got a tour afterwards, and it was an amazing facility. If you haven't been there, I feel like we had tried to set up a tour or something. I don't know if I missed that, but I was really glad to get a tour last week, and they've thought of everything. They have amazing staff that are working on it. The building is just about completed, but they are in desperate need of nurses to work there. So if you know anybody or anybody listening, they really need staff. But anyway, I was just amazed and just delighted at how thoughtful and beautiful this facility is and how needed it is, and hopefully we'll be able to help lots of folks once they get started.
Yes, I did miss a number of things. Comments from committee members, liaison assignment reports. Thank you for that, Amanda. Anybody else have any? Okay, then we have some appointments to make, or one appointment? One appointment. It's an advisory board appointment to the COFA Advisory Board. Does anybody want to move that? Travis moves, Amanda seconds, thank you. Any discussion? All right, all in favor? That is unanimous, thank you. Then we have the minutes. Does anybody want to move the minutes from March 20th? Travis moves, Amanda seconds, thank you. Any discussion? All right, let's have a vote. All in favor? That is unanimous. Okay, now did I miss anything?
I think you're good now.
Okay. Any other business before this committee? All right, in that case, we are adjourned. Thank you, everybody.
I think it's a record meeting.